Kidney is a very faithful organ, so they try to do their best until the last moment. But when it comes to the end, when they cannot work anymore, then it means the toxic material in your blood, the soluble material, is going to be staying there. At that time, you need to get rid of these toxic materials. That's your potassium and sodium, and all these materials must be removed from the blood. At the last part of the end-stage renal disease, then you need to end up with a replacement treatment. The best replacement treatment is transplantation for sure, because at that time you'll have your life just like how it was before. But if you do not have a donor, at that time you need to end with dialysis. There are two kinds of dialysis. You can have either peritoneal dialysis, where they put a catheter into your abdominal cavity and then they just give some fluids, and after this fluid is keeping the toxic electrolytes, they are bringing it outside so that the toxic materials are exchanged by using peritoneum as a membrane. So peritoneal dialysis is one of the alternatives, but most of the world uses hemodialysis. That means you need to have a vascular access, and they just clean your blood by passing through a membrane. It generally takes 4 hours and it's 3 times a week. During this 4 hours period in hemodialysis, almost 80 liters of blood circulation happens, and by this way, the toxic materials, they just be removed from your system. But unfortunately, neither hemodialysis nor peritoneal dialysis, as life quality and as the extent of life, is not comparable to transplantation. So we generally refer these techniques as a bridge to reach transplantation as the latest goal. Well, it's not the same to have a kidney and just get rid of the toxic material immediately, compared to be dialyzed and just get these toxic material, get higher and higher in your blood and try to remove them partially by dialysis in 3 times a week, or with peritoneal dialysis daily. And because of this toxic material remaining in your body, the body starts to have some adverse effects. And maybe a couple of days in normal life, it can take 3 or 4 days of yours in dialysis. So there are several studies showing that if you are in dialysis for a long time, the outcome of kidney transplantation is not improving as well. So the best thing is, if you have end-stage renal disease and if you need a replacement treatment, and if you have a donor, at that time, kidney transplantation is the best alternative for you. So there is no reason to stay long in hemodialysis. The best thing is to have preemptive transplantation, to have transplantation without going to dialysis. But even if you are in dialysis, it's always better to have transplant as quick as possible. By this way, your body will not get tired with dialysis.